All right, we have time for a few questions today. First question, let's go to Brenda Goodman at WebMD.
Hi there. Dr. Walensky, I know that I'm glad you brought up vaccinations in kids, and I know that a lot of kids just became eligible for their second dose, and I wondered if you had any safety updates for us yet on have you seen any cases of myocarditis in particular reported?
Yeah, thank you for that question. We continue to comb those data. We haven't had any thing that's come to us as a signal, and we continue to watch that carefully.
Next question. Let's go to Betsy Klein at CNN.
Hey there. Thanks for taking my question. Obviously, we heard a little bit from Dr. Fauci just now on the Omicron variant, but do you have any updates on when exactly we can expect to learn more about the severity of disease from the variant, how that information from the studies you outlined will be shared with the public, and furthermore, when decisions could be made on when those travel restrictions imposed last week could be lifted?
Dr. Fauci?
Yes, as I was alluding to on the slides that I showed, most of the data on the severity will likely come first from South Africa because of the volume of cases that they have. Given severity, hospitalization, and death are always lagging indicators, I would imagine it will take at least another couple of weeks before we have a good handle, and then a really good handle a few weeks thereafter. So I would say we shouldn't be making any definitive conclusions, certainly not before the next couple of weeks.
On travel restrictions, the second part of your question on Southern Africa, as we've talked about, they were taken out of an abundance of caution to help slow the spread and give us the time to prepare. And as Dr. Fauci just described, evaluate the Omicron variant. We are continuing to see, as Dr. Fauci presented, thousands of cases every day in Southern Africa. There are lots of unknowns about the transmissibility, the severity, the vaccine impact of Omicron. And we will learn more about the variant, as Dr. Fauci just described and Dr. Walensky described, over the coming days and weeks. So I want to emphasize that we understand that this limitation is causing difficulty for those in Southern Africa. But we think a temporary limitation on a limited number of countries until we have the answers we need is a reasonable measure for a reasonable period of time. And we are continuously, day-to-day, reevaluating the policy.
All right, next question. Let's go to Cheyenne Haslett at ABC News.
Hey guys, thank you. The new CDC guidelines out last night suggest using an at-home rapid test before indoor gatherings. Dr. Walensky, can you define what that means, when people should be using these tests and how often? For example, should people be using them before they go out to indoor dine, or is it just for larger gatherings? And to Dr. Fauci, is it fair to say on the timeline of when we'll know things that we'll have a good idea of transmission before we know about immune evasion, and maybe the last part we will have a good idea about will be severity?
Yeah, let me just talk about sort of gathering. The first thing I just think we need to reiterate is, the test that as an at-home test can tell you if you have disease right now and whether you might transmit it to somebody else. But the best thing that we can do is to protect from getting disease. So of course that means vaccinating and boosting. That means wearing masks in public indoor settings, especially in areas of high and substantial transmission. What I would say about using the rapid tests is that, when you're practicing all of those prevention interventions and you want to gather together, for example, for the holidays in a multi-generational household, and everybody's been practicing those prevention interventions before you come together, everybody might want to do a test for an extra set of reassurance to make sure that that you can gather safely together. So that's the intent of those updated guidances.
Dr. Fauci?
Yeah, with regard to the sequence of our ability to know transmission versus immune evasion versus severity, it should be understood that transmission and immune evasion are going to be rather linked, and it will be different depending upon the demography of the country that you're dealing with. For example, we have a much more vaccinated population than those in South Africa. they have a much greater proportion of their population infected with HIV, which would be important with regard to their ability to mount an immune response against prior infection and against vaccination. So I would think that there will be in parallel appreciating transmission as well as immune evasion. It will be very important when we get enough cases in this country to determine if prior infection versus prior vaccination, what kind of impact that has on the transmissibility as well as on the severity. But the last part of your question, it is very likely that the last thing that we'll get a good handle on will be the broad severity or not of the infection. Thank you.
Next question, let's go to Zeke Miller, AP.
Thanks for doing this. Wanted to follow up on a question that Jen Psaki got yesterday in the White House briefing regarding testing, earlier comments on rapid testing as well. Why isn't the U.S. following peer countries and making at-home tests, rapid tests readily available to people? For instance, you fly to the UK, you get a 7-day package of rapid tests from the NHS. Why not send rapid tests to every American in an attempt to sort of make people safer during the holiday period? Isn't there still COVID funding available that can make that accessible?
Thanks, Zeke. And I think that we do want to make sure that people have access to free tests everywhere in America. Our approach is not to send everyone a test as sort of independent of their need or desire to get tested. We believe the most efficient and effective approach is more nuanced than that. And if you have private insurance, we're making sure you'll get reimbursed by your insurer for at-home tests. And we made sure that tests you get from your healthcare provider, like PCR tests, are covered with no copays in either situation. If you're uninsured or on Medicare or Medicaid, we've quadrupled the number of free pharmacy tests with a priority on vulnerable communities, 20,000 pharmacy and community sites today. We're sending 50 million free tests starting this month to convenient locations like health centers and community centers. So everyone in America has access to free testing in an efficient and effective way. And we've developed multiple access points for free testing. But we've made tremendous progress, as you know, across the last months. The president has invested billions of dollars here. We will continue to invest. We'll continue to expand affordability and access to tests with more competition. There are now 13 tests approved from the FDA. That's up from none at the beginning of the administration. And that leads to innovation. That leads to prices coming down and competition. So we're going to continue to increase the access of free testing to everyone in America.
All right, last question. Let's go to Shannon Pettypiece at NBC.
Hi, I guess along the line of these rapid tests, is there any concern that with more people doing these at-home tests, the CDC is going to lose visibility into how many cases are out there or what type of variants are circulating if so many people are doing the tests at home and that data is not going through a lab and getting reported?
It's a good question. Over to you, Dr. Walensky.
Yeah, it is a good question. We want to use these rapid tests because they're convenient and they let people do the right thing. They let people self-quarantine or self-isolate when they're positive so that they can actually do the right thing and prevent transmissions. We are still doing over 1 million PCR tests a day. And many of those rapid tests, people seek medical care and then get a confirmatory PCR. So we really do still have quite a good window. But the rapid tests do allow people to sort of be empowered with their own health and also to protect their loved ones rapidly when they get a test that's positive.
All right, everybody. Thank you for bearing with us in this different format today. We'll be back together later in the week. Appreciate everybody. Thank you.